I want you to educate us on mental awareness. Yeah, awareness. So once again, you are welcome.
Thank you, sir.
So I want to know what causes mental awareness or mental health. What causes it?
Okay. To give introduction about mental health.
Sure.
Mental health, when we say mental health, it is a way the individual take care of themselves mentally.
Okay.
So how you are able to control your emotions, your psychological state,
Okay.
that helps to balance your health. That helps you keep you in good faith. You know, aside we taking care of our health through our diet, our exercise, our physical things, we take care of our health through our mental states too.
Oh, okay.
Yeah, and it's the way we do, the way we carry ourselves, the way we handle situations, the way we think, the way we reason, that also helps us to take care of ourselves. Because don't forget that if you don't take care of your psychological state well, you cannot even take care of yourself.
For
Yes.
Oh, okay.
And there are a lot of things that causes this. Some includes depression. And as last week when I came, we treated stress.
Yeah, sure.
And we treated that stress causes depression.
Sure.
So when someone is through stress all the time, going through stress all the time, and is not taking care of it, that ends up in depression. It can affect the mental state of the person. We have something like dementia, which is a mental state that mostly old age people get. They tend forgetting things, not remembering things.
Oh,
okay. Even they will be here talking to you and they are not.
They are not stable.
Yes, they can't even remember that I said this. I put this
Sure.
Dementia.
Sure.
So some of the causes is also dementia. Some of the causes is also bipolar, where the person has a mood swing.
No, without is that one a disease?
Yes, it's a disease. Yes, bipolar.
But how about, like, is it a general disease? Because most of us have.
It's not really general. Sometimes congenital or hereditary. It's in the family.
Oh, okay.
And maybe the dad had, and when he gave birth, the son or the daughter is also having. Or sometimes it's a way of life, or drugs the person took, or maybe a situation the person got into it, and it turns out to be this way. And bipolar is when someone has a mood swing and it's not stable. Actually, today the person can be happy and can be calm. But the next few seconds, you will see them talking. Every secret you've told them, they are bringing it out. In fact, every rubbish you don't want them to say. It will shock you that they can stand in front of the president and talk anyhow.
But I want to, sorry to interrupt, but I want to ask, if, like, there's this saying that said, if someone, like a quiet person, like someone who's very quiet, he or she is not bipolar, but like he or she may see his or her friend and be like, you have this energy. I don't know whether it's energy or is what the bipolar, but what I'm trying to say is you can see someone, you can sense, me particularly, I can sense a good energy and a bad energy. So if I sense a good energy and I start, even though I'm a quiet type, and I start to like talk to the person, we kind of vibe, like go deep, laugh, that one to make me bipolar or something.
Oh, it's not. It doesn't make you. As I was saying,
I actually say, is it a disease?
It's actually, we classify it as a condition, a disease condition. Yeah, though the public, some don't see it that way. Some even see it as a spiritual something. They will say when the person is there, maybe the house people are doing, Africa perception and norms and belief. Then and if you for it's a one be but we also don't see it that way. We also see it as a mental problem, a mental condition that the person is going through and needs attention. But some families will not see it that way. So instead of them to take the person to a psychiatry hospital for attention and the necessary treatment to be done, they don't. Then they'll be taking the person from churches to churches. But we see that as a problem, a condition that the person need help. even in children. And bipolar, as I was saying, it starts from young age. So there are some families where they are there. You yourself will see my child is not behaving well. A time will come, he or she will take this thing, spoil everything, then take blade,
okay,
cut everything.
okay.
There are some things children will do, and we know it's normal. But when the child is going beyond it, then you yourself have to suspect that no, it's not normal. So it's actually a mood swing disorder, where anytime there's that attack triggered in the person's mind, the person will switch into a different mood. You'll be surprised, but later they'll come back to their senses and be normal. We have treatment for that, and sometimes to some of the causes of mental health is anxiety. When you are too anxious, you are too worried. Some people think a lot than the word thinking. Their mind is not resting at all. Yeah, every day they are, and any little thing that happens in their life, they are getting worried. Especially some of the married women. Why is he not back at 6:30? Every day he comes at 6:30. So even if he's stuck in traffic and he hasn't gotten home early, why is he stuck? Why is not? Even if the husband called, I'm stuck in traffic, still they won't believe, and they will be thinking. If you come home and your phone is there, she's not able to catch it. Why am I not? So you are just being anxious, trying to find meaning to things you are not even supposed to find meaning to. Yeah, that anxious state also can cause your mental health. And also attention deficit. Attention deficit.
What is it?
When we say attention deficit means you lack. So attention deficit, you lack attention. There are some people in their life, you can see they are not organized. They are attention deficit. You give them a work that, take this thing, put it here, and after come and take this thing and put it here. They will take this thing and will put it here instead of here. You told the person, and after will come and take this thing and put it here instead of here. Like they don't pay attention. Even if you are communicating with them, even if you tell them to do something, you tell them to focus and achieve the purpose or the reason or the they don't do. They always do some things in short. Like they don't complete things. And when you are telling them or teaching them something, there are some children in class, when you are teaching them, you can say that I'm teaching you this, he's putting this one here, he's putting that. They lack attention. And such a situation, you can correct it early. But some families don't take it serious. They will be saying his children character, when he grows up, he changes that. At the end of the day, the person will grow with it and it will become part and parcel of them. Some people too are hyperactive. Hyperactive means being so overactive. Hyper, the word hyper in medical term is over. So hyperactive. And it happens in young age. Actually, a lot of mental health conditions start in young age. That attention are not paid into.
Really, I thought like from 30s, 25, 35.
It depends. It depends when you get to that age and it's happening. It depends on the situation. That one is life situations that put people in that. But there are others that it starts in young age. And the hyperactiveness I'm talking about like that, you will see that this child, you cannot tame him or her. No matter what you talk, he or she doesn't listen. Or say idea. If he is doing that, he's doing that. And he's always busy, active. At least children are active, but they rest. But you see, this child doesn't rest. He's always busy, active. It should tell you that no, my child can be going through something. But the funny thing is, we don't take it serious. So it can affecting the person, because anytime someone is hyperactive, they are not stable in mind. Yeah, and any hyperactive person is an anxious person, anxiety, because if you give them a work to do, let's say he hasn't seen the outcome, but he's in a rush because he is always overdoing things, he's in a rush to see that no, and this, so they are even anxious all the time. If you promise them something, okay, tomorrow I'll buy you this, tomorrow hasn't even come, then they are, hey, we said tomorrow this or this or they're always hyper, they are not really calm. And it's also a cause of mental disorder, because even though you can be active all the time, but sometimes you have to be calm. So yeah, it's also a cause of mental disorder.
So is there any way one can prevent mental health problems?
Oh yeah, there are a lot of ways that we can prevent mental health awareness. As I was telling you earlier, the first thing I told you that some of these signs and symptoms are seen early in child age, early, that people don't pay attention to it. So early detection can help. Observation, like observing your child. How's my child behaving? Is my child behaving different from other children? Then you can say that no, this child is having a mental problem. Let me quickly take him or her to psychiatric hospital or a psychologist so that they see the problem the child is having. Also, we need to talk to a mental health personnel or a psychologist. It's very funny that
is it different from therapy?
Yeah, it's a therapy. Actually, if you go to see a psychiatric or a psychologist, it's a therapy you are going through, because they will arrange maybe some time for you that between this time you will come for discussion or a health talk or this. And one thing is, a lot of people, when they are going through stress or depression or anxiety or post-trauma disorder, like you had an accident and it's affecting your brain or any other thing, they seem not to talk to health personnel. Some people feel like I can solve it on my own. I'm a big girl or I'm a big boy. But sometimes we need people to share our problem with. Because there's this word, they say a problem shared is a problem solved. So sometimes, even if it's not a health personnel, but your pastor or someone older than you, or even a friend that you have to communicate with, that I'm going through this, I'm trying to find solution, I'm not getting this. How do I go about it? At least if the person give you an advice that helps the situation, it will relieve you from that stress. And there are some conditions also you will need medication. Yeah, it's not everything that you will need only counseling. Some you will need counseling, but some you will need medication. Like someone who has taken drugs, marijuana, cocaine, you can name them, and they become hyperactive and attention disorder that is affecting their lifestyle and everything. Because you and I know those that are on drugs, they are not stable. You see them at the roadside and the way they behave, the way they talk, they don't talk normal. They are always active, they are always not stable, they are always high. Those people, they can be managed under medication. So as you are counseling the person, you are also giving them medication that will calm their nerves, or sometimes even if it has to induce them to sleep. Yeah. And also, one of the ways we can take care of our mental health is taking care of ourselves. And when I say taking care of ourselves, it's broad. Our dieting, our exercising, our physical appearance, because
Self-care.
yes, self-care. If you are so sound when you are going outside and you are in something that is not good, let's say you are going to the president's house, I'm not sure you will wear a dirty something.
Self-care. You remember the last time I told you guys about self-care? That one should be talk no.
Yeah. So first of all, getting attention for yourself, your intakes, what you take in. A normal person will not, excuse my words, eat anything anyhow. Yeah, so your intake, it should be clean, neat, balanced diet, a healthy food. And also, at the end of the day, exercising. I always say exercising helps. What helped our predecessors and our ancestors to live long, walking was part, but due to technology and upgradement of everything in the world, the advancement of the world, now we have cars, we have this, that. We tend not to exercise and the other thing. So we can involve ourselves in exercise to help release stress in our body, in our mind, everything. Yes, and if you need a talk to see someone, the right person, it's not everyone that you can
Yeah, because
take.
I wanted to even ask you after this question. I wanted to ask you, say, how can one deal with it? Because someone you can tell, but you are living in a cold world whereby sometimes you tell your problem to someone, or just say, okay, and then they say,
It's another words.
It will make it even worse. And the funny thing is, the person you tell your pain to, he or she will also tell to another person, and making it worse for
Even
you.
worse.
So how can one tell an individual
There
about?
is this incident, a lady stole money in a workplace.
Oh, okay.
Yeah, and she told a friend actually. Nobody saw she stole the money, but she told a friend that I've gotten this amount, blah blah blah, and wanted to give the friend some. The friend said, "No, I don't like it." Not knowing she would go and report the lady. That's why she didn't take the money. And asked the lady, "What will you be using the money you stole for?" The man, oh, she said, "I want to start a business, so even soon I'll leave this company." The friend went to tell the boss, and eventually the issue got spread
at the office.
Yes, at the office. To cut everything short, the lady who stole the money committed suicide because she couldn't stand the disgrace. She couldn't stand the pointing of hands. Hey, this girl stole the money. This girl. Do you know the problem?
No.
The problem is she told an immature person. She told, even if the act she did was wrong, she couldn't get the right person to address the issue. So always ensure that the person you are going to tell your problem to, one, you can find confidence in it. And you know, most health workers, because of the nature of our work and because they make us swear about confidentiality of a patient, it will be better if you think you can't trust anyone. Go and tell a health practitioner, a psychologist, because the person will not risk his or her profession or license because of you. And it's expected of us to keep the confidentiality of a client. So at the end of the day, if it's your pastor you trust, if it's an elderly person in your area or in your family or this one you trust, address the issue to the right person, not in a person that you can't trust, and at the end of the day the issue will come out or it will not be solved properly, and it will lead to another thing, because not everyone can stand disgrace or can carry themselves to the next
sure. But I think that sometimes the pastor is even worse.
These
They
days
can use your problems to preach.
Yeah. So you weigh. So you have to weigh. Yeah. What you are saying is actually true. Gone are the days we hold pastors so highly esteemed and respected them and trusted them for our confidential issue. But these days there are a lot of things. If you go and tell them, the next day, if you don't take it, they will even call you and say, "You came to my house to tell me this, didn't you come?" Because they are interested about the fame. So that at the end of the day, they will give you, some will give you prophecy and said, "You came to my house to tell me this. I gave you this prophecy, and this has happened." Some are interested about that, but they don't know, because they don't have any medical knowledge about the well-being and the mental being of the individual. They don't handle things the way they handle. Don't forget, spirituality is different from psychological or emotional things. Though in some culture it's work hand in hand, but it's totally different from each other. So if you think it's a spiritual thing and you need to address it to a pastor, address it to a pastor. And if you think this is not a spiritual thing, assuming you are going through a broken heart, or you lost a loved one, could be a mother, a father, a brother, a sister, and you are getting you depressed, making you cry all the time, or just and you think you need counseling because it's affecting your job, it's affecting you, interrupting on communicating with friends and other things, go and see a well-trained psychologist or a medical practitioner, rather than going to see a pastor that will relate everything to spiritual. this, that. Well, I believe in spirituality, and as far as it's there, I know it's real. But it's not everything that we have to take it spiritually. Sometimes we have to take it physically also, because there are some things it needs physical attention, and it will be solved. Yes.
Thank you.
You're welcome. Say.
Renewal. Your name is always Renewal. Thank you for coming.
Thank you to
Thank you for coming. Probably we'll call you some other time to teach to educate us more on our health and our daily living and our thing. Hello viewers, we're back again with another episode. Try to subscribe to the Brown Talk Show, and you all heard what she said. I hope said you know ready into our daily activities. Money every year when you say bear, obviously when you are just an American Libiano. Yes, a boy that your system you find in my basa be a so like today to come back again. So I hope you guys love the I hope you guys like what Miss Onyame said, and I hope that some other time we'll try to bring her back to the show again for us to teach us more. Thank you.